Okay, good afternoon. Coming into a long weekend here in New South Wales and Queensland. This is our most recent COVID-19 update. I only have Batty with me today, David Batty, because basically the changes that have taken place over the last week only relate to the Eastern Seaboard. Just like to make a couple of comments following on the webinars we have done this week, which have been very well attended, and thank you for those who joined in to those webinars. There was some confusion coming out of yesterday's webinar about whether staff will have to be vaccinated in New South Wales when we get to the 70% open rate. The comment that came from the gentleman on the webinar yesterday was, well, it's not a public health order yet, and therefore it's not legally required. That's, I guess, technically true, but the conversations that both David and I have had either together or separately, and they were confirmed again yesterday afternoon, is that here in New South Wales, when we get to 70% and gyms are reopening, both clients and staff will have to be double vaccinated. Now, we'll be putting up a fact sheet later on this afternoon, which has come from New South Wales Health, which talks particularly about the 80% restrictions or relaxations. And it clearly states in that fact sheet that all staff and clients will have to be double dosed vaccinated at 80%. Now, you don't have to be a rocket scientist to work out if that's at 80%, it's absolutely going to be the case at 70%. The health authorities have told us the public health order will be coming out next week. Our very strong advice to you is that you go on the basis that you will be required as a staff person to be double dose vaccinated at 70%. Again, as we said at the start of the webinars last week, what we're going to be providing today is not a forum for debating or the pros and cons of vaccination or not. We are dealing with the facts. We're dealing with the world we are living in. Fitness Australia and myself do not support mandatory vaccinations. We encourage all Australians to get vaccinated once they've had appropriate consultation with their medical health authorities. However, if the government at some stage does mandate vaccination, then clearly Fitness Australia will be recommending to all our members that they comply with that. So David, having said that, maybe we start up north, which is the simplest to deal with straight away in Queensland, although bearing in mind that that is also a moving feast, as we've been seeing where the NRL is going to take place and who's going to be allowed to attend it.
Yeah, it's going to be an interesting couple of days coming up. So the first little part with that is that masks are back to mandatory indoors. So all of your facilities will require people to wear masks indoors. There is the exclusion still that applies for vigorous exercise as a part of that, but moving around and doing anything else, they'll be required to wear masks. You're back down to 4 square metres rather than 2 square metres, but that usually won't affect too many of our facilities at this stage, though those ones that are doing things like yoga or other classes where it's a little bit narrower may have to implement a maximum capacity number in line with that.
Thanks, Dave. You also reminded me that yesterday in the webinar, there was a incorrect statement made by the presenter in New South Wales when he said that gyms at 70% are limited to 20 people. That is not correct. Gyms are limited to a 4 square metre per person. The 20 person comes into play with groups. And even in that context there, if you have space to run more than one group of 20, taking into account the 4 square metres per person, and you can clearly delineate the 2 groups or 3 groups or whatever, that is permissible as well. So moving down the coast, David, New South Wales.
Down to New South Wales. So there's going to be some bits and pieces around New South Wales that come up that will be interesting. But the main wording here is that everybody's going to be, and I would just prepare for the eventuality that everybody will need to be vaccinated to enter those facilities. The thing with classes as well is, by the look of it, it will follow what was happening in regional, and those classes will require face masks to be worn at all times during those classes. So that's another part that may come up. It hasn't been, as we don't have the order itself, but it's just something to possibly prepare yourself for, so that if it does eventuate, then you're ready to go. If it doesn't eventuate, that's great. Then we don't need to worry about that. But it looks like that may be a part of the initial, that 70% may change at 80.
So as soon as we get the public health orders, as soon as they're released, they'll be up on our social media platform within 5 seconds. Okay, Victoria, David.
Victoria, so today there was an announcement in Victoria that authorised workers will be required to be vaccinated to actually use their authorised worker permits. So that includes personal trainers, which we worked really hard to get on that authorised workers list and to ensure that we're recognised as a professional in our industry. And a part of that is being recognised as that professional and that essential service. It also means that we've got the responsibilities that are aligned with that, which will be, in this case, vaccination.
Yeah, so I mean, that's the key message there as well. Two key messages: the vaccination, which Dan Andrews put out this morning, a statement about that. But I guess the very much the upside of that is that we are moving closer to be classified as an essential worker, essential service, which means, heaven forbid, we have COVID 23, 27, 39, whatever it might be in the future, we will be treated differently as we have been for the last 30 odd months. 18 or so months, just seems like 30.
Seems like 30, yeah.
So, David, we've got a few questions here at the moment. Maybe we start going through those ones.
So first question up around COVID marshals for Greater Sydney and New South Wales. So a part of the conversations that we've been having with both the ministry as well, the health, as well as the ministers, has been around not requiring COVID marshals and making sure that we are able to put in place systems that would allow us to show that we are actively discouraging anybody that is not vaccinated from attending your facility, and to that point, disabling them before they're allowed to enter, and then them showing proof that they can enter your facility. So by doing that, it's going to give you also the greatest chance of not having any issues with the health department, police, anyone else.
Okay, so are indoor and outdoor swimming pools opening at 70% for Greater Sydney?
That's a tough one. I'm trying to find the final answer on this. So there is a potential, there was an announcement through the news earlier today around potentially 19th of October and pools being 18th or 19th of October and pools being opened on that date. I haven't been able to confirm anything yet. So once I've got a confirmation, I'll make sure we put it out on our socials. Yeah,
we've certainly raised that with the New South Wales government here. It's rather strange that gyms can open, but the indoor swimming pool can't at the moment. It does not make sense given what's happening with swimming pools, etc. Have you seen any information restrictions around sauna use in New South Wales?
I have not. So there hasn't been anything that's come up. At the moment, I would plan for no use of saunas to start off with. And then if it's allowed underneath the rules, we'll make sure that everybody understands that well. But if you plan for the worst case scenario and something else changes, that would be great. But I would plan for it not to be open to start off with, and then any changes to that, we'll make sure that we announce them as soon as possible.
I've just seen a text come through. I believe our Premier here in New South Wales may have stepped down.
There we go.
Okay, so in New South Wales, do we know the 20-person rule for group fitness for aqua aerobics or the indoor pool? Well, at the moment, indoor pools can't open, as I understand it. 20 people can do Zumba, but they can't do aqua Zumba, it would seem. So we are working on that, Brett, to try and get that clarified. As we just indicated, that is nonsensical, that will be the situation. So I'm trying to get that sorted out. From Canberra, from Donna, can you please tell us about Canberra?
I can tell you about Canberra. So Canberra at the moment, they've announced their roadmap out. There'll be no big changes for our industry until that 80% or any industry. Once again, we've been able to open up in line with hospitality, but that's coming up middle of the month. There's the major changes happening in the ACT where you'll be allowed 25 people indoors. And then from there, 2 weeks later, you'll be going to a much larger number. I think it's 150. So we'll put up the roadmap and a link to the roadmap for everybody there, but that starts as of the 15th of October.
So from Laura in Victoria, David, are we able to have face-to-face interviews and training of new staff in our studio gym prior to reopening at 80%?
This is something that I've put forward to the government at the moment and asked for a ramp-up stage or what they call a blackout stage, where you're allowed to open up a facility with no customers in it, with just the people who are going to be running it, to ensure all the adequate training and safety is allowed. That's been put up there and we're looking to hopefully get that okayed as soon as possible. But as soon as we get the word on that, I'll let you know.
Vicky, Victoria again, where do fitness centres, leisure centres fit in the roadmap? There doesn't seem to be any mention of when gyms are likely to open.
Fitness leisure centres in Victoria, was that, sorry, Barry?
Fitness centres Where do fitness centres fit in the roadmap? There doesn't seem to be any mention of when gyms are likely to open.
In Victoria, we're opening our indoors as of the 80% double vaccination mark for up to 150 people, 4 square metres, 20 people in a class.
Yeah, it certainly it has been missing in a couple of their releases, but certainly the conversations we're having.
It's also they also released a roadmap that actually describes exactly what each industry will be allowed to do at each step. And it's definitely a part of that. So if you go underneath there, we'll be able to share the link if you would like it, but it's definitely there.
A couple of questions on, is the trainer included as part of the 20 in group classes?
No. So the person running any of these, all the states so far, except for I think South Australia, which actually included them, most of them have not included them. When it came to the outdoor cap of 5 people, that was due to the fact that it was only allowed 5 people total to get together. When it comes to businesses running, they will not include the staff member under these caps.
Will masks be required? Sorry, I've just lost that one. Will masks be required by trainer and/or client in PT session in their home in New South Wales?
The answer will be yes. Anytime that you're indoors conducting business, they will require masks until that threshold is met, and then the PT will continue to need to wear their mask unless there's a safety issue or the person is hard of hearing. So there are some exclusions around it, but they don't apply in most cases.
Question from Jenny, which I think is in New South Wales. Will all staff be required to be vaccinated in gyms, i.e. cleaners, etc. as well?
That's a tough question. I believe that anybody that enters the facility will be required to be vaccinated, and that's something that we'll put forward to the government around the cleaners side of things. So if the facility is completely closed, whether they'll be required to be vaccinated, I'm unsure on that, but I would lean on the side that it is probable that they will want everybody vaccinated, but I can't give you a definitive on that one.
In the ACT, does the 25 people limit include the staff?
In the ACT, the limits have never included the staff. So it's always been the total number of patrons attending the facility.
From Chris, when Metro New South Wales opens, will the regional New South Wales clubs have to follow the Metro restrictions, or can they continue as is?
They will have to go along with the rest of New South Wales. So that was an announcement as a part of about 2 weeks ago with Gladys. She described that everybody would have to fall in line to the same restrictions. They're very concerned that if those restrictions were eased in regional, that the regional New South Wales would slow their vaccination rates and therefore cause a big problem if there was an outbreak, and those areas cannot afford to have those outbreaks. So they're really concerned around that side of things.
From Dina, can I, as a PT, train my clients in their home residence outside?
Is that in Victoria, New South Wales?
It's not clear.
Yeah, so I'll do it for each of them. Both of them are outside. You're not allowed to visit people as it stands in either state anyway. So if you're not allowed to visit somebody's home, you cannot conduct business in their home either, unless it's for the purposes of fixing up a leaking pipe or emergency works inside the home. But otherwise, you can't have anybody in your home anyway. So that makes it the simple one. You cannot have people in your residence.
From Ashley, as a gym that runs Bikram yoga, our exertive fitness practice, will masks be required?
Depends on the state. New South Wales, as it stands, they're going pretty hard line with everything requiring masks in classes anytime that a group is spending more than about 15 minutes together as one solid group. And if they're a group of 20, they are going pretty hard on the mask requirement. But we're not going to know that until the actual order is released. Once again, it's going to be based on what's happening in regional New South Wales at the moment, and that is no matter what, every class requires everybody to keep their masks on.
Okay, Carmen's just put a question in the chat room. If we can have those in the Q&A, that'd be good. It's about creches. Carmen, it's going to depend if your creche is a licensed childcare facility or a child minding facility. The childcare, if it's a licensed childcare facility, it'll come under the Childcare Act, and they will have their own requirements. If it is a babysitting or a child minding facility, that's a good question, David. They should, I imagine, be able to open with the social distancing?
So I had that, I put that to health. New South Wales Health have said that anybody under the age of 12 will not require vaccination to enter the facility, but their parents will. So that's where that stands. So because people under the age of 12 do not require vaccination, the grey area at the moment that we're waiting on the order will be those that are between 12 and 16 that can get vaccinated, but have not been mandated in any other of the restrictions yet. So we're unsure where they will sit.
Yes, and if that creche or childcare services in Victoria, the staff will have to be double vaccinated as well. It's one of their mandated professions. From Nikki, I have a personal trainer that lives in another LGA, Greater Sydney. Can she travel to another LGA to work after October 11?
Yes, that will be around being authorised to be in those work sites. So they're authorised to travel based on that, unless they're under a lockdown restriction. So some areas may still have certain requirements where they will not allow people to leave those areas based on the numbers. But in general, the general wording will be, yes, they will be able to leave their area as of that date.
In Sydney, how many people are allowed for outdoor training groups?
At the moment, if they're in groups of up to 5 people outdoors and all vaccinated, now every person in that group must be vaccinated. That's the personal trainer down to the last member in the group. In these groups, if they are found to not be vaccinated and they are checked up on, then there is the potential that every person in that group, the PT down to every single member, could also receive those fines.
Yeah, and a question from Anthony, which relates to the authorised workers in Victoria. Does that also include visiting associates, for example, of physios who rent consulting rooms?
I believe so. So I'd also believe that because physios are on that authorised list, they're going to be requiring it anyway because they're an authorised worker. So every authorised worker in the authorised worker list will be required to have at least 1 vaccination by the 15th and 2 vaccinations by, I think it's the 28th, I believe. Yeah.
Okay, another one from Anthony in Victoria, but this applies in New South Wales as well. Can unvaxxed people with medical exemption still enter gyms once the fully vaxxed rule only comes in? If so, what proof do they need?
That is something that we've put forward to health at the moment. It's going to be a part of the vaccination trials coming up to ensure that we have these all ironed out. So there's some vaccination trials heading into regional Victoria, which will test out a lot of these rules, test out how they're going to work, and they'll have a mandate to be able to use these rules appropriately. So I can't give you a direct answer yet, but once we have had a couple of days into this, we'll have a lot more information before opening.
From Jamie, Tamara, Central Coast, New South Wales, can we train unvaxxed outside gym one-on-one as currently allowed in gyms outside area or grounds?
As it stands, yes. So there is no change to that rule. I believe that will be the rule that will continue on throughout the vaccination requirements for business. I believe that there will be an allowance there for people to be able to, and it's a bit of a recognition on the kind of effects that we have on people's mental and physical health. So I believe that that will still continue, but there is always a possibility that they'll change and do something like what's happening in Victoria and make it that all authorised workers will be required to have their vaccinations. So as it stands, yes, but that could change.
Okay, from Jamie in the ACT, when we go to 100 people in the facility on the 29th of October, would this include the 20 people in a class if they're in a separate studio?
That's going to depend on the wording of the Act. So ACT has quite often done it per space rather than per venue, but if they put a venue cap on, it'll be the total cap will be on the total people in the venue. If they put it on a space cap, it'll be on the space. So that will depend on what's happening at the time, whether they use that distinction.
Also in the ACT, do we know anything about vaccination requirements for staff and clients and masks during classes?
ACT is not looking at a vaccine passport or any requirement to have vaccine. They've got such a quick uptake in the state anyway, in the territory, sorry. So they're not too concerned by people leaving it too long or not doing it because they're just waiting for somebody else to do it. So there's not an issue there in the ACT around passports and things. When it comes to masks, I'm unsure. That's going to depend on what's happening at the time and how comfortable the government's feeling.
Okay, from Sandro, when the numbers increase in regional Victoria from the current 10?
So the current 10, that would be the 10 people indoors. There is a change coming up at the, I believe at the 80% mark at the 70% double vax mark, which will put you back in line with Metro, and they'll be the, I believe they're sitting at 100. Oh, sorry, there is a change. They're going up to 30 people. So that will be end of next month, late. So it'll be 70% double vaccination.
Okay, from Coralie, when I'm doing outdoor PT training, can we ask to see their COVID certificate?
You can ask anything. So there's not a problem with asking. They, as a human, don't need to supply that, but then you've also got the right to refuse service. So that's going to be something that you're going to have to do as a part of it. In New South Wales, if you're in a group of 5, I'd say it's quite a smart thing to do, especially, but I would like to say that most of the people that we work with would like to stay safe during their whole time and ensure that their members as well as themselves are safe. So I would say you can ask, and then it's going to come down to your requirements or the government requirements, whether they need to, you can either stop training them or continue on.
Yeah, and certainly in New South Wales, it's looking like, from what the government is saying to us, that the onus of responsibility will be on the individual, not the PT or the manager or the employer. So if you do ask and they refuse to show it, you have at least fulfilled your obligation, and you do not have to offer a service to them if they're not prepared to comply with what you're asking. From Donna, still unsure your answer to my question for the ACT group classes was 20 people from the 15th of October. I thought it was the 1st of November.
It's 25 people, I believe, and I will find out the exact specifics for you in a couple of minutes and I'll come back to you. That's not a problem.
In New South Wales, does the business owner need to be vaccinated if they're not on the premises?
If they're not on the premises, the answer would be probably not, as they are not actually interacting with anybody. So it'll be people who are in the facility will be required to have it. Those people not in the facility, I cannot see why there'll be a mandate on that.
In Victoria, is there any talk of increasing the number of participants for outdoor training?
There is talk, but at the moment with the numbers popping as high as they are, doesn't look like we're going to be getting what we were hoping for, which was an easing of that out to a much larger number.
Okay, I think we've answered Donna's question about the 2 dates there. Okay, I think, excuse me, I think the message at the end of all this, David, is for all of our members, gyms, personal trainers, etc., to when they do open under whatever regime it may be in whatever state, but they do absolutely everything they can to make sure they are putting common sense into place, keeping their clients, their members safe, because what we don't want is a situation where the media latches onto poor practice, poor behaviour by a gym, a personal trainer, whatever, and all of a sudden we are thrust back into where we were previously, being closed, and treated unfairly. So really the onus is on everybody to do the right thing here. Thanks for all your answers again, David. As we know, this is a moving feast again, and we will keep all of our social medias updated as we know, as soon as we get that information through to you. Please keep checking in. We'll do another update next week because, as we've just said, things are changing so quickly. On the screen at the moment is a QR code. That's from our standards and professional development side. They're just really asking what you would like from your professional development, etc. If you feel so inclined, you can click on that code, complete a survey, and you have a chance winning tickets to the Philex virtual coming up in a couple of weeks' time. And I'd also like to remind people that at the end of that Philex virtual summit, which is Friday, 2 weeks today, we will be announcing the successful recipients of the Fitness Australia Award. So we're really excited about that. And there's been over 1,000 nominations for that. It's free to come and attend it. We have Dylan Alcott doing a presentation as well. Please take the time to join us on Friday in 2 weeks' time. And thanks again, David, and thanks for all the participants. Thank you.
Not a problem at all. Thank you. Bye.
Bye.